for the economy of Halifax, Yarmouth, Pictou County, all these, the fishers of all the people in this Nova Scotia, Mr. Speaker. Everybody should be aware of what workers have done, and instead of these kind of half-hearted platitudes from time and time again, let's put some real teeth in this. Let's allow workers to have their rightful place. Let's respect them. Let's give the ones that do not want to be organized decent coverage around the Labour Standards Code. Let's allow a trade union act that allows members to organize and stay organized. Let's do that. And let's do, when government has a stake at the table, that they will get involved and they will work for workers' rights in a meaningful way. Thank you, Mr. Speaker.
The honourable member for Richmond.
Thank you, Speaker. Speaker, it's a pleasure to rise today and speak a few words going into debate on supply. Speaker, I want to take this opportunity. It's one of my first opportunities to speak in this House without being a specific critic portfolio. To take this opportunity to thank the people of Richmond County for the confidence that they have placed in me, both in 1998 and in 1999. Speaker, March 24th, 1998, a date I'm sure you'll be very familiar with, was the first opportunity I had to present myself as Liberal candidate for the riding of Richmond County. And not too long ago, a month ago, March 24th, 2003, marked 5 years since that first election, which, Speaker, I'm sure you're very familiar with that date also. Speaker, it's hard to believe 5 years have already passed, 2 elections, and it's great to see that we're still here after those 2 elections. Speaker, I want to take this opportunity to express my sincerest thanks to the people of Richmond County who have placed their confidence in me, that it's been truly an honour and a privilege to stand here and to advocate on behalf of the people of Richmond County, to bring their concerns to the floor of this House, and to try to be the best possible representative for the people of Richmond County. Mr. Speaker, I can tell you that in 5 years, I started off with a small filing cabinet and grew to 1 cabinet, then 2 cabinets, and I've now reached 3 and just about ready to purchase the 4th filing cabinet, and approximately 1,400 files later, it's been truly a pleasure to be able to work with the people of Richmond County on the concerns that affect them most, Mr. Speaker. What I want to do today is take the opportunity to speak specifically about some of the issues that affect not only most of the people in Richmond County, but especially the seniors in Richmond County. And like many other rural areas in this province, Mr. Speaker, the riding of Richmond County has a significant population of seniors, people who are retired that have worked all their lives in Richmond County. In fact, Speaker, like many other areas, we also have numerous of our original residents who left to go to other provinces, who have returned now in their retirement to live in Richmond County, and we're clearly pleased to have them. Speaker, one of the number 1 issues which clearly that I've heard loud and clear from seniors in Richmond County has been the issue of the state of our roads in the county itself. Speaker, needless to say, seniors are very frustrated when they see the cost of gasoline increase, the cost of home heating fuel go up, the insurance rates are increasing, which are taxable to a benefit to the government. They see the cost of renewing their licenses increase, the cost of registering their vehicles increase, yet when they look at the quality of the roads, it's just not there. Mr. Speaker, the government will well recall that in their own Blue Book, they made the commitment that any revenues from either gas tax, fuel tax, license fees, or vehicle registration would go directly towards rebuilding, upgrading, and maintaining the roads of this province. And Mr. Speaker, clearly that commitment has not been kept, and the people of Richmond County are very frustrated when they see the state of our roads, which is why, Mr. Speaker, when the Premier was recently in Richmond County, a mere week ago, I issued a challenge to him, and I asked him that the Premier should take the opportunity while he was in Richmond County to travel on route number 4, going from the communities of Grand Anse to River Tillard, which encompasses also the large community of River Bourgeois. Mr. Speaker, since I was first elected, I have advocated that this road was the #1 priority for the people of Richmond County to see that this road be upgraded, that it be repaved and brought back to an acceptable standard. And I recall when the government house leader, when he was minister, where he wrote on a couple of occasions asking for what were my priorities, I clearly stated out to him that my #1 priority was route #4, going to Grand Anse River Tillard. And we were told from the Department of Transportation office in Sydney that that also was their #1 priority. Yet, Mr. Speaker, 5 years later, there has still been no significant work done to that particular strip of road. Mr. Speaker, the people of River Bourgeois are extremely frustrated. I hear the government house leader say that's not true. He will probably be trying to refer to work done on route #4 past St. Peter's to Sydney. What I am referring to is route #4, which goes from Grand Anse to River Tillard before you reach St. Peter's. That strip of road, Mr. Speaker, is in disastrous shape. This government has been not only patching the patches, they're patching the patches that were patched by the patches. That's how far back it goes. And 5 years that this is what the people on that road have been treated to. Mr. Speaker, I invited the Premier to travel throughout the roads in Arishat, either the lower road or even the main road through Arishat, where the post office is, where the doctor's office is, where St. Anne's Community Nursing Centre is, where the drugstore is located.
Order, please.
The Honourable Member Richmond has the floor.
Thank you, Speaker. This is these are important roads used by the residents throughout Ilmadam to access these important services. And I can tell you, Mr. Speaker, they are in disastrous shape. And the residents, and especially the seniors, are saying that in their long history, they do not recall ever seeing the roads being in the shape that they are in today. And again, Mr. Speaker, they asked, why is our money not going towards repairing the roads in Richmond County? And this government has failed to answer that in the last 5 years. Mr. Speaker, the roads throughout Rocky Bay, going towards Cape Laround. Mr. Speaker, I wrote to the minister on this road, the House Leader, when he was there, and I asked him in a sense of desperation on behalf of the residents that if he would not send asphalt to fix the road, the least he could do was send a lawnmower and gas. Because this road has come in such a shape that there's actually grass growing along the middle of the road. And the residents now are saying, well, we'd hope at least the government will send us a lawnmower so we can properly maintain the roads and at least make sure the grass doesn't grow too high down the yellow line going on this road. Mr. Speaker, that is neglect. The people of Richmond County have paid too much in taxes over the years to have that type of quality roads. Mr. Speaker, you look at the growing communities out in Dundee, Roberta, the Points, where there are more and more developments taking place, more and more residential developments, and you look at the state of the roads, they clearly cannot sustain the additional developments taking place. There are many people who are retired who have come to live in that community because it borders along the beautiful Burdor Lakes, and they are extremely frustrated as to the state of their roads. I have discussed this with them numerous times and will continue to lobby on their behalf. Just last week, Mr. Speaker, a lady who had just moved into the Lardwes community who lived on Liberal Harbour Road called in exasperation and said, I can't leave my house. And I said, well, why can you not leave your house? She said, because I'm afraid to drive on the road. And I said, well, now you're going to have to explain yourself. Why would you be afraid to drive on the road? She said, well, I'm going to send you pictures. The reason she was afraid to drive on the road, Mr. Speaker, is because she was afraid to get stuck in the mud on the road because there was such a thickness of mud on top of her gravel road that she was afraid that her smaller vehicle would not be able to make it through. Now, Mr. Speaker, is this where our tax dollars are going? Is this the type of roads that Nova Scotians should expect to have to put up with, or the people of Richmond County should have to put up with? And again, it's unfortunate when the Premier was in the area, he didn't take the opportunity to go and visit these roads and then allow him to stand in this House and tell the people of Richmond County that they should be pleased with the quality of roads that they have, considering the amount of taxes they pay. Mr. Speaker, seniors in Richmond County are extremely concerned about the high cost of insurance and the fact that this government has not brought forward any sort of comprehensible plan to deal with the issue. Mr. Speaker, seniors on fixed incomes cannot handle such sharp increases in their insurance rates. More and more we are seeing seniors having to give up their mobility by saying, I just can't afford to keep my car insured. And what a shameful thing that is, Mr. Speaker, that people have worked all their lives, have provided for their families, have helped grow our economy, now have to abandon their vehicle because they can't afford to pay insurance, and a government that refuses to do anything about it. Mr. Speaker, the high cost of home heating oil, again, is something which has had a very negative effect on seniors throughout Richmond County, and how disappointed they were. In fact, I had someone the other day come to me and I asked, did you apply for the $50 rebate? And he said that $50 rebate was nothing more than a mockery by the government. To only send me $50 was a mere mockery. I didn't even bother applying because I thought it was just the government laughing at me. What a shameful thing, Mr. Speaker, that this government that is now giving out a $155 check, $68 million worth, money that will go to people who have only those who have paid provincial income tax. Now, we all know that many of our seniors do not pay provincial income tax, as they are on fixed incomes, on low incomes. And the thought that they will not be receiving this check, I believe, is shameful, Mr. Speaker, because the government is clearly telling them, through the finance minister, that he does not believe that seniors have contributed to the economy of Nova Scotia. Yet they have been asked.
Please, member Colchester, Muscataba Valley, in a point of order.
Yes, I'd just like to very quickly, on a point of order, take the honourable member for Richmond down memory lane a little bit. His predecessor, the former Minister of Transportation, Richie Mann, never provided 1 foot or 1 teaspoon of asphalt to the riding of the beautiful Colchester, Muscataba Valley, all during the savage years. Not 1 foot of asphalt. Richmond did very well. And for that member to stand in his place, he should be ashamed of himself.
Order, please. Not a point of order. It's a disagreement of facts between the two members. The honourable member for Richmond has the floor.
Mr. Speaker, never will I apologize for standing up for the rights of the people of Richmond County here in this House. Mr. Speaker, I want to talk again. Mr. Speaker, I had a call from someone who said $50 rebate for oil. Well, we heat our home with electricity. We've paid more income taxes. We've paid more taxes toward increased electricity, yet we do not qualify for the rebate. Again, these are people who will also not see the $155 check. Mr. Speaker, I've had the privilege of working with numerous people who've applied for housing grants. Speaker, it is a very important program to the people of Richmond County, and is one which is underfunded, not only by the provincial government, I will admit it's underfunded by the federal government also. And I would hope that with the Minister of Community Services responsible for housing, who has received $11 million from Ottawa for housing programs, and yet he has said he will only spend $2 million of that, I would certainly hope that some of the additional money that he has would be put towards RAP grants, forgivable loans, and monies to help seniors stay in their homes, stay in a safe environment, and remain in the household which they have worked so long and so hard to provide for both them and their families. And I will continue to be an advocate for housing grants for the seniors of Richmond County, and to try to get more funding for this program on their behalf. Mr. Speaker, I raised yesterday a very important issue about safety concerns at the provincial seniors housing units. Speaker, we have such housing units both in Petit de Gras, in Arishat, Discouse, Louisdale. We have one in River Bourgeois. We have one in St. Peter's. We have one in Lardoise. And I may be forgetting some of them there. But, Mr. Speaker, the issue that was raised about having a backup power source in case of power outages to ensure the safety of these seniors, I believe, is a reasonable request. And I would certainly hope that the minister will take action and present a plan where these types of issues can be addressed. Speaker, the people of Richmond County have clearly indicated to me that they're very interested in the theme that our leader Danny Graham has brought out about more healthy living and more active lifestyles for the people of Nova Scotia. More and more we are seeing seniors organizations throughout Richmond County undertake activities that promote more a healthy lifestyle, healthy eating, and more exercises for seniors throughout the county, and I look forward to continuing to work with them in that regard in promoting that. In fact, Speaker, I want to take this opportunity to congratulate HRDC and Marlene LeBlanc, who is working with them. In fact, it's under a program that is sponsored to help educate our seniors about falls, slips and falls for seniors. Now, Speaker, I had Ms. LeBlanc come and meet with me and show me the numbers. You would not believe, you would be alarmed, in fact I was alarmed, at how many seniors' deaths are caused by slips and falls, how many serious injuries to seniors are caused by slips and falls, and how that there's so many simple solutions to trying to address this. I think it's a wonderful program. I know that Ms. LeBlanc has worked very hard throughout the county to educate groups and I certainly look forward to working with the different community organizations and seniors to try to address some of these concerns. And I congratulate the federal government for funding that particular program and that position. Speaker, one of the other issues I also want to touch on that the seniors in Richmond County are very concerned about is the status of our 2 public health nurses in Richmond County. There's been some recent changes that have taken place in the public health office, and I've heard from numerous seniors who are concerned that the level of service will not be maintained. I urge the Minister of Health, through the local district health authority, to make sure that the 2 public nurse positions in Richmond County are maintained. More importantly than that, to make sure that bilingual service is provided through those 2 public health nurses, as many of our seniors in Richmond County, while they do understand some level of English, they are much more comfortable in the French language and are much more at ease with it. And it's an important service for them because the public health nurses provide a lot of education to them. But with that, Mr. Speaker, I look forward to the next campaign. I look forward to meeting with the seniors throughout Richmond County. I enjoy their stories. I enjoy the advice that they do provide me when I have the opportunity to speak with them. I have the privilege of having a grandfather who's 95 years old, paternal grandfather, and a maternal grandmother who's 96. And it's a special relationship. They do provide great life stories and great advice that all of us can use. And I certainly look forward to, again, going on the doorsteps of seniors in Richmond County and continuing to advocate on their behalf and in their best interests. And I thank them for the confidence they have shown in me in the previous 2 elections and look forward to that confidence again in the upcoming campaign. Thank you, Mr. Speaker.
Thank you. The Honourable Minister of Justice.
Thank you, Mr. Speaker, and I'm pleased to stand in my place today to talk a little bit about my home community, Truro, and Bible Hill and Salmon River, and some of the turmoil and stresses that it has undergone in the last couple of weeks. What I'll be saying, Mr. Speaker, will be in some ways a supplement to what my colleague from Colchester-Musquodoboit Valley said about the distresses and tribulations many of his residents underwent at the same time, and also many of the residents of my colleague Bill Langell, who represents also an adjacent constituency. As members of the House know, there was widespread flooding in Nova Scotia on March the 31st and April 1st of this year. I don't think any community was harder hit than my community of Truro, Bible Hill, and Salmon River in the whole province. Mr. Speaker, it just wasn't the amount of water that came down. It was the damage that this water did. For those of you who know the Truro area, you know that when you cross from Truro going out to Bible Hill, going through go across what we call the Salmon River Bridge, out underneath what we call the subway, which is really a railway bridge. For those of you who are not familiar with our area, but it would be going from Truro out to the area where the agricultural college is. There are pictures, Mr. Speaker, that are available on the internet, and you could white water raft in that area from the force of the water that was rolling down the road. So the force of the water was such, Mr. Speaker, that it actually shredded the parking lot in a Tim Hortons. It dug craters in the yards of various residents in that particular section of town. It looks as though somebody took a backhoe and went down the street in some places. Mr. Speaker, we've had water in that area before, but it was the force of the water coupled with its depth, and there was considerably more damage done than there has been, I think, in other times. Indeed, those people who are longtime residents of our community who have seen water come and go tell me that it's probably the worst flooding that occurred in the Truro area in the past 60 years. Mr. Speaker, what I really want to talk about is the water is now gone, but was the cleanup and the response to what was indeed an emergency situation. Mr. Speaker, 2 years ago, the County of Colchester, the town of Truro, and the town of Stewiacke, the municipal officials there got together and they comprised or put together a joint emergency measures plan. Mr. Speaker, this was the first of such a plan in the province, and it was done with the support of the Emergency Measures Organization and what is now Minister Olive's department. It meant that decisions were going to be made jointly and that there would not be any concern for municipal boundaries in responding to an emergency. Thankfully, Mr. Speaker, this was the first time that that particular plan was put to the test. But I want to assure everybody that the effort that the municipal officials went to put that plan into effect was well worthwhile because it worked marvelously. The municipal officials on Monday, March the 31st, came together to assess the damage, and collectively they declared a state of emergency in Colchester County, which includes the town of Truro and the village of Bible Hill, as well as Salmon River and the other areas. Mr. Speaker, and at that point, they had a single spokesperson for the organization, and in this case, it happened to be Mr. Gary McIsaac, who was the CAO in Colchester County. Perhaps some of you saw him on television on April the 1st. It worked very, very well. The three groups, the town of Stewiacke, the town of Truro, and the village, the county of Colchester, had gotten together and they had appointed a single regional emergency measures officer. Now, this is a local emergency measures office, as to be distinguished from the regional one that belongs to Minister Olive's department. His name is Carl Shaw. I've known Carl for quite some number of years. He and I were colleagues at the Nova Scotia Teachers College. He's also, as well as being the regional emergency measures officer, among his other hats, he heads up the hazmat unit in that area in northern Nova Scotia, and he's also the chief of the Salmon River Volunteer Fire Brigade. Anyway, I want to pay particular tribute to Mr. Shaw in what he did in offering assistance to the people who needed it. Last Saturday and Sunday, Mr. Speaker, I visited the homes of a good many of the residents who were affected by the flooding. And it was surprising the number of people. There they were cleaning up, horrible mess. There were some of them actually had water in their living rooms, Mr. Speaker. But the number of people who took the time to compliment those who responded to the emergency. The group of people that was really organized by Mr. Shaw. They talked about the volunteer firefighters who came and pumped out basements. The other thing, Mr. Speaker, speaking of the volunteer fire brigades, the Salmon River, the Bible Hill, the Truro Fire Brigade, they were all in, Valley Kemptown. They did a remarkable job, and what they did at that time under this emergency measures plan, Mr. Speaker.
Order, please. Order, please. Now, Mr. Justice has the floor.
Thank you. Is that they did away with your municipal boundaries, and this mutual aid became, if you were on one side of the water, you would respond regardless of where the emergency was. And it worked very, very well. It's an example of community cooperation and community support, Mr. Speaker, which was just marvelous. And I think people have to remember that during the height of this flood, there was only one way into Truro. There was only one way into our community. And if you wanted to get into Bible Hill or Salmon River or something like this, the roads were flooded. You had to go all the way out to 102, out to 104, and come in from Valley Kemptown. And you couldn't get into Truro that way. It was a very, very slow process. Mr. Speaker, there were many, many individuals who came to the front to help those who needed help. I mentioned the volunteer fire brigades and what they did, and in terms of pumping out basements, helping neighbors move, providing transportation, providing traffic direction. We have to talk also about, Mr. Speaker, the ground search and rescue people who came out at that time, and there, Mr. Speaker, you had an area that was flooded as well, and you know how the volunteers responded up in your community. The Ground Search and Rescue, which is an organization in Nova Scotia which doesn't always receive the recognition it deserves. But I can tell you, Mr. Speaker, when there are difficulties in Nova Scotia, like the volunteer firefighters, the Ground Search and Rescue is an organization that will come every time at a minute's notice. Mr. Speaker, I want to speak as well of the Truro Police Department and the RCMP and the roles that they played and how comforting they were and the assistance that they gave to keeping, when I say keeping order, I mean keeping things flowing, watching where the traffic was going, helping people when they needed help, and in general responding to those who called them. Mr. Speaker, they were part of that emergency measure plan. I'd like to speak to and mention some people by name. I'd like to mention Bill Mills, who's the mayor of Truro, and the CEO of the town of Truro, Jim Langell, and the works crew in the town of Truro, along with the police agency, who responded as quickly as they could, and the organization, and that the Truro streets were open as quickly as they were, and the mess was cleaned up. Mr. Speaker, one of the things that happened in this particular event was out in Valley, the Irving Sproul lumber mill was there. They had $1 million worth of lumber and boards, of lumber and logs floating down that river. A lot of it landed in the town of Truro, landed on the streets of Salmon River, landed on the streets of Bible Hill. Mr. Speaker, the works crews from Colchester County and the town of Truro responded very, very quickly to pick up those obstacles. And there is a picture, one of these things is that in the subway in Bible Hill, there's actually a picture of a bale of lumber that has come about 6 kilometers down the river and is parked on the street there. If anybody's interested in that, my colleague Bill Langell happens to have it. I'd like to mention as well Mike Smith and Gary McIsaac from the Colchester County, who led their effort, were part of that thing. And the people in Chris Wright and David Roddy and Sheldon Dury from out in Stewiacke, and Wayne McCormick and Bob Christensen from the village of Bible Hill. Mr. Speaker, it was a marvelous example of the community pulling together to really meet a challenge. And, I've lived in Truro for a good portion of my life. I've seen the water come and the water go in Truro. But I can tell you, Mr. Speaker, like others, we have not seen the water come the way it did and do the damage that it did. But one of the interesting things, Mr. Speaker, of all the homes that I was in last weekend, and I went to homes on Ford Street, Cross Street, Nova Drive, Park Street, Normandy Avenue, North Street, Farnham Road, Edward Avenue, Salmon, Riverside, Avon, open the Salmon on Queen Street, on Moore Street. Mr. Speaker, I was in a lot of homes, but everyone to a person basically looked at this and said, well, there's not much sense complaining right now. We've got to get this mess cleaned up, and that's what they did. But so many said, and I said, look, this is really tough. And they look and they say, I've seen the pictures. There are others worse off than me. I'm really not going to say too much. We'll just clean it up. Was the remarkable resilience of the citizens of that area that were flooded. And I want to tell you, some of those homes were an awful mess. And there's going to be a lot of work to clean it up. But they, like everybody else, were disappointed and hurt that it had happened to them. But they knew they got to get on with life. And also recognized that as distressful as their own situation was, is that they said, I know that I'm really bad off. And this came actually even from people who had water in their living room, 8 or 12 inches in their living room, which meant that their basement was filled, saying, well, it's bad, the water's going down. I guess we'll clean it up. We'll have to do some things. But, I looked at the films in Badger and other places, and, you know, as bad as it is here, we do recognize that some people were in worse situations. Mr. Speaker, I was proud to represent those people as the MLA from Truro Bible Hill. I want to tell you, I don't think, in talking with those people who had gone through that experience and how they approached it, and it really made me proud to represent that area. The way the community responded, the way the emergency teams responded, it was just really just thought an outstanding example of community. And as I say, you know, I guess this time, the last time the water came, I was able, because of what I was doing, to go around and give people a hand mucking out their basements. I wasn't able to do that this time. But in visiting them, it was really heartwarming to see how the community responded to help their neighbors in what was a really, really difficult situation. And I guess, Mr. Speaker, I would also like to mention in the last 10 seconds that thank heaven that this province in 2000 had the vision to adopt that federal financial disaster assistance plan, because a lot of those people are going to have some help now that they wouldn't have had previously. Thank you, Mr. Speaker.
Motion is carried.
Thank you. I'd like to recognize the Government House Leader.
Chairman, would you please call the estimates of the Minister of Health?
I'd like to call the estimates for the Minister, or for the Department of Health. And I would like to recognize the member for Richmond that has 47 minutes left in turn. And member, you have the floor.
Thank you, Mr. Chair. And take a bit of a different twist from my line of questioning last opportunity I had to speak to the Minister. Mr. Speaker, in 1999, this government campaigned on a number of different platforms, different commitments that it would make. Individual candidates in their own ridings, Tory candidates, made different commitments about what they would do if they got elected. Mr. Chair, I can tell you that one of the meanest, most crass political campaigns that was undertaken by any Tory candidate in 1999 was by none other than the Tory candidate for Halifax Citadel. And Mr. Speaker, I would remind you, at that time, and I can table for the recollection of any of our colleagues, this infamous postcard that was sent out in the middle of the election campaign. A postcard where a candidate stood for public office and said, "Elect me, and I will put people out of work. I will cause hardship to their lives. I will cause stress to their families if you elect me. In return, I will open up hospital beds once I put those people out of work and once I close that industry." And I can tell you, Mr. Speaker, I have been watching politics in this province since I was 14 years old, for the last 16 years. And I can tell you, Mr. Chair, that I have never seen a more crass, mean-spirited political campaign before in my life, my short life. Therefore, Mr. Speaker, my question today to that same candidate, the Tory candidate in Halifax Citadel, who is now our Minister of Health, I would ask her today to tell this House that after 4 years of being elected, after having closed Sydney Steel, would you please inform Nova Scotians today how many new hospital beds have been opened by our government in the last 4 years?
I'd like to recognize the Minister of Health.
Thank you, Mr. Chair. And Mr. Chair, on the issue of hospital beds, even the member opposite's own critic was saying that our proportion of hospital beds to population in Nova Scotia was too high, and that he credited the DHA in the Cape Breton, industrial Cape Breton, with doing a wonderful job in trying to put a different emphasis on health. on population health. And I think, Mr. Speaker, that in our 4 years in government, we have stabilized our healthcare system, and we have guaranteed multi-year funding. There will still be problems, but we have achieved considerable success. As well, Mr. Chair, we have been able to take many patients out of hospital beds and put them where they more rightly belonged in terms of being in long-term care and in nursing homes. And in that way, we were able to reduce wait lists for nursing homes by 23%. Thank you, Mr. Chair.
Thank you, Minister. I recognize the member from Richmond.
Mr. Speaker, Mr. Chair, in 1999, ma'am, you told the people of Halifax Citadel, vote for me and I will open up hospital beds by closing Sydney Steel. I ask you again, you made a commitment to the people of Halifax Citadel that you would open hospital beds. I ask you again, can you please give me the number of hospital beds that have been opened? Not the amount of patients you've transferred around, not the ratio of beds to patients. How many new beds, ma'am, have you opened since you've been elected in 1999, or has your government opened? The exact number of new beds.
The Minister of Health.
Thank you, Mr. Chair. And I certainly realize estimates debate is quite free-ranging, and the member can discuss Cisco as much as he likes. I don't intend to. What I will say now is that acute care beds do not translate into health. Thank you, Mr. Chair.
Thank you. Minister, recognize the member from Richmond.
Madam Minister, you told the people in 1999 that you would close an industry, and upon closing that industry, you would then be able to open up more hospital beds. This is not question period, and there's no place to hide. There's no place to make your sarcastic comments. We got 47 minutes here today. I ask you again, Madam Minister, you made a commitment to the people of Halifax Citadel who are watching your performance here today. I ask you again, how many new hospital beds have you opened or your government opened since 1999? Will you please today tell your electors what you have done on that campaign commitment you made to them in 1999?
I'd like to recognize the Minister of Health.
Thank you, Mr. Chair. Healthcare has been and continues to be a priority for this government. Thank you, Mr. Chair.
Thank you. Minister, recognize the member from Richmond.
Mr. Speaker, I'm going to ask you again. In 1999, you told the people of Halifax Citadel, through this crass postcard that you sent out to them, that you would open new hospital beds. I ask you again, Madam Minister, how many new hospital beds has you or your government opened since you were elected 4 years ago in 1999?
The Minister of Health.
Thank you, Mr. Chair. And Mr. Chair, priorities matter, and health care is a priority of this government. Thank you, Mr. Chair.
Member from Richmond.
Madam Minister, in 1999, your postcard right here says, closed, open. I ask you again, since 1999 and in 4 years, how many hospital beds has your government opened as per the commitment that you made to the people of Halifax Citadel back in 1999?
Before I recognize the Minister of Health, I'd like to recognize the Attorney General.
Mr. Chairman, is there any reason why this man is not talking about the estimates?
It's not a point of order. I'd like to order, please. Order, please. That's not a point of order. It's up to the chair to decide if the comments are relevant, and I will pass this over to the Minister of Health. Although I would like to remind the member from Richmond that he's holding up a prop, and unless he's prepared to read from that or to table that's not permitted. So I will order, please. Order. Well, then he has to. Then if he's going to ask them to table that, and he's doing that. So I will recognize the Minister of Health. Minister of Health.
Thank you, Mr. Chair.
Minister of Health.
And certainly, if the member opposite wants to repeat the question, I'll repeat the answer.
Thank you.
That health care is a priority of our government. Thank you, Mr. Chair.
Thank you, and I would recognize the member from Richmond.
Mr. Speaker, this was a crass, mean-spirited, political attempt to get elected, where the member then stood as a candidate and said, vote for me, I will close an industry, I will cause people hardship, I will put families out of work, and I will open up hospital beds. Minister, today you are the Minister of Health. Your constituents are watching. 4 years later, I ask you again, how many new hospital beds has your government opened as per your promise to the people of Halifax Citadel by the cynical postcard that you got elected on in 1999?
The Minister of Health.
Thank you, Mr. Chair. And Mr. Chair, we have done a great deal to stabilize health care and health care costs in this province, and our government remains committed to the #1 priority of Nova Scotians and Canadians, and that is a sustainable health care system. Thank you, Mr. Chair.
The member from Richmond.
Mr. Speaker, 4 years that this member, who was then the candidate for Halifax Citadel, went out, pitting one end of the province against another in the most crass, mean-spirited way, and saying, elect me, I will go in, I will close an industry, and I will open up hospital beds. What we have clearly seen after 4 years is the minister will not even stand in her place today with her constituents watching and say that I never meant it from day one. I never meant to open up any hospital beds. I am now the Minister of Health. I am in charge of a budget of nearly $2 billion, and I haven't opened one new hospital bed either here in the Halifax region or anywhere in this province since I have been elected. Shame on the minister for standing up and trying to say her priority is health care when her own commitment mailed out to her constituents said she would open hospital beds, and she has failed. And now she gives us nothing more than political spin and political lingo rather than admitting that she has failed her constituents, that her attempt to get elected with these postcards was just a means of getting votes, where she had absolutely no intention of living up to the commitment she made to the people of Halifax Citadel. And I ask the minister again, will she inform this House and give us a specific number rather than hiding behind her shameful political spins? Give us the numerical figures. How many new hospital beds has your government opened since you were elected in 1999?
I'd like to recognize the Minister of Health.
Thank you. Thank you, Mr. Chair. And Mr. Chair, health care is a priority for our governments. And as I mentioned earlier, one of the things we did on coming to government was free up hospital beds for patients needing urgent care and reduce the waiting lists for long-term care by about 23%. For example, Mr. Chair, just last year, there were 70 beds in the QE2 occupied by people who should have been in nursing homes, and we managed to free those beds for patients needing critical care by placing those patients in nursing homes. That's one of the examples in which we've been able to make the health system better, and we will continue to do that, Mr. Chair.
Thank you, Minister. Recognize the member from Richmond.
Mr. Speaker, in 1999, that minister, then the Tory candidate in Halifax Citadel, along with her premier, who was then the leader of the Tory party, said, we have a plan for health care, we can fix health care, and one of those things is let us close Sydney Steel, and we will open up hospital beds in this province. We will address the waiting lines that are in the Halifax area with our numerous health institutions and everywhere else in this province by opening up new hospital beds. Yet today, Mr. Speaker, we all know amongst our own family members, let alone our constituents, that the waiting lines are still there, that the calls to say there's no hospital bed available for you right now, you will have to wait another week, you will have to wait another month, are still the calls we are getting. This is the member that told the people of Halifax Citadel in her own little postcard that her solution was to open more beds, have more beds here in Metro, have more beds throughout this province, and provide better health care for Nova Scotians. I ask you again, Madam Minister, You who sent out this postcard, which I'm assuming that you supported that crass, cynical campaign, will you give us the numerical figure of 0 or more as to how many new beds your government has opened since you were elected in 1999 with the personal commitment you made to the people of Halifax Citadel?
Before I recognize the Minister of Health, I would just remind the member from Richmond that we are here doing estimates of 2003, 2004. Although it's been historic for this committee to allow some reference to the past, it's important for us to ask questions mostly directed to the budget 2003, 2004. And now I would like to recognize the budget 2003, 2004 with some reference to the past, but let's not be repetitive in bringing up the past. The Minister of Health.
Thank you, Mr. Chair. And Mr. Chair, again, we have freed up many hospital beds and improved that situation, and health care remains a priority of our government.
Order, please. Order, please. Order, please. Order, please. The Minister of Health.
Thank you very much, Mr. Chair. And of course, I have answered the question many times, and I will answer it again, that we have stabilized health care. We continue to put more money into health care. It is a priority of our government to improve the health of Nova Scotians. Thank you, Mr. Chair.
Thank you, Minister. Recognize the member from Richmond.
Thank you, Mr. Chair, and with all due respect, when you can get your Premier to stop referencing to financial events of 1993, continually repeating the past, then certainly we'll be more than interested in talking about that. Madam Minister, could you please tell us, in your budget table today, how many new hospital beds will be opened under this budget, or how many other hospital beds have been opened in your previous budgets? More specifically, will the minister confirm that under her government, under her time as a senior minister in this government, and under her time in health, that her government has opened 0 new hospital beds in the province of Nova Scotia? Yes or no?
I'd like to recognize the Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, as the single entry access system continues to operate, obviously we do free up more hospital beds that are being used by nursing home patients. Mr. Chair, I think the member opposite does know that most governments across this country, including the federal government, are aiming to change a lot of things about the way the healthcare system operates. And that includes new models of healthcare. That is what the Health Reform Fund is all about. It is what the Primary Healthcare Transition Fund, initiated in the year 2000, is all about. And all of these measures in provinces all across the country, we are attempting to change the models of healthcare and improve the health of all Canadians. And our government will continue to make healthcare a priority. Thank you, Mr. Chair.
Thank you. Minister, I recognize the member from Richmond.
Mr. Chair, what I do know is that this is the candidate, this is the person, the Tory candidate, who undertook a mean-spirited, cynical, and crass political campaign that clearly said, a vote for me is a vote for more hospital beds. Mr. Speaker, today, Madam Minister, your constituents are watching. 4 years later, they are asking, you said you would open more hospital beds. It's credibility time, Minister. I ask you again, will you confirm, yes or no, that your government has not opened up one single new hospital bed since it has been elected?
Thank you. I'd like to recognize the Minister of Education on a point of order.
Mr. Chairman, at my count, this would be the 8th time that the honourable member has put the question, and there are in this House, Mr. Chairman, and the rules of the House apply to the committee as well, rules with respect to repetition, and I would ask you take that matter under consideration with respect to these proceedings.
Order, please. That would be considered a point of order, and I'd like to address that. I have advised the member from Richmond that some of the information he's been supplying has been a bit repetitive, and I've asked him to restructure his questions to the minister, and I'll monitor that. And time I feel that it's being repetitive, I'll call it to his attention. I'd like to recognize the member from Richmond.
Mr. Speaker, I guess we'll see just how high our Minister of Education can count, because the people of Nova Scotia expect answers. And as to Joy's, Minister, that this is not question period, because your little sarcastic answers that you only have to give 3 times and then you move to another question. That's not the case anymore. Now's the time where you are to be held accountable to your electors, be held accountable to the people of Nova Scotia, and be held accountable for a $2 billion budget that you are responsible for. Mr. Speaker, or Mr. Chair, the Minister has clearly made a personal commitment through this pamphlet she sent out during the campaign, a crass, cynical, political attempt to try to undertake a campaign which she has not upheld. She is now the Minister. She has a budget ahead of her. I ask you again, you have a budget in front of you. Could you point out the line item in that budget which shows where you have opened up new hospital beds in this province, either in this budget or any previous budget to that? Again, Minister, your constituents are watching. We expect a forthright answer. Will you tell us whether you have actually opened up any new hospital beds, yes or no?
I'm going to recognize the Minister of Health, and then I'm going to ask the member from Richmond to restructure or to go on with another question. In talking here with the clerks, we feel that this is starting to be very much repetitive, and we would ask you to carry on with another question. The Minister of Health. Yeah, Minister of Health. Order, please. Recognize the Minister of Health. And then we'll ask the member from Richmond to go on to another question.
Thank you, Mr. Chair. I certainly feel that I have answered the question many, many times in terms of the matter of priorities and how our government makes healthcare a priority. I will certainly be prepared to repeat that again, in answer to that question, and possibly the member from Richmond should take the cotton out of his ears. Thank you, Mr. Chair.
Thank you. The member from Richmond.
Mr. Speaker, Mr. Chair, a question has simply been put to the Minister. The Minister has refused to answer that question, which is why we must continue to ask her that question. That is why estimates are different from question period. We are not limited to just 3 questions of the Minister refusing to answer and then having to move on to another member. That is why under here, Minister, it's not possible to hide. It's where you are to be held accountable for the estimates. You have a budget ahead of you. You have a $2 billion department. You made a commitment in 1999 that as part of your budgetary process, there would be new hospital beds that would be opened. I have asked the Minister because she refuses to give an answer. I put it to her again to show us where in the budget that there is funding available to hold up to her personal commitment to the people of Halifax Citadel, to her commitment to the people of Nova Scotia if she was elected, to in fact provide for new hospital beds in this province. There's been 4 years under this administration. I offer the Minister the opportunity again to point out where in her budget that there is funding for new hospital beds and what figure that she can give us as to how many of those beds have been opened in the last 4 years.
The Minister of Health.
Thank you, Mr. Chair. And Mr. Chair, this government has provided many, many millions of dollars more for our healthcare system since we have come to power. We have reduced waiting lists for nursing home beds and in turn freed up hospital beds for other kinds of acute care. We have given the district health authorities millions of dollars in new funding, and the millions available for this year are certainly outlined in this budget. Some of the funding is for hospitals, some of the funding is for clinics, And all of that is available here in this budget to be examined. Most of the CEOs of the DHAs, with the possible exception of the hospital in Kentville, would agree that they have enough hospital beds. The demands and the DHAs have been given a guarantee of increased funding of 7% for the next 3 years. Mr. Chair, sustainable healthcare services is the aim of this government. It's the aim of all governments in Canada. It is extremely important to the people of this province and the people of Canada. And our plans for spending this year are clearly outlined in our budget estimates. And I repeat, healthcare remains a priority. Thank you, Mr. Chair.
Thank you, Minister. I'd like to recognize the member from Richmond.
Mr. Speaker, in 1999, as a Tory candidate, and her party as a whole said what the previous government was doing was not good enough. Our solution is a vote for us is a vote for more hospital beds. And Minister, those are not my words. They are your words here. It says open on hospital bed, and the name underneath is Jane Purvis of Halifax Progressive Conservative Party. That is not me. I did
Order,
not
please. Order, please. I'd like to recognize the Attorney General. And would you order, please? Order, Minister. Order, please. Order. No, Minister. Are you standing on a point of order?
Yes, I am.
Thank you. Go ahead.
A point of order, and I have to support my my colleague from Antigonish. This line of questioning. If he wants to campaign for Danny Graham, if Danny Graham wants to campaign, if Danny Graham wants to take on the challenge from Halifax Citadel, Danny Graham should have gone out and got himself elected, and he didn't have the courage to do that.
Order, please.
And to have him, and to rig for somebody to get up there and do crass political campaigning during estimates, Mr. Chairman, is wrong.
I'd like to order, please. Order, please. I'd like to tell the Attorney General it's not a point of order. Order, please. Order, please. That was not a point of order. You had a comment. I had asked the member from Richmond to restructure his question. He did at that time move from his form of questioning and moved into the estimates of 2003, 2004. I acknowledged that. I returned back to the member of Richmond, and I would ask him to not to be repetitive in his further comment, but to carry on with the estimates. And the member from Richmond has the floor.
Mr. Chair, the people of Halifax Citadel watching today will judge the minister for her actions, will judge the minister for refusing to admit that this was nothing more than a cynical and crass political attempt to say, I will put people out of work, I will cause harm to their families, and vote for me, I'll open new beds. She has clearly not done that. Mr. Speaker, Mr. Chair, the people of Halifax Citadel will clearly pass judgment, and they've today seen the real face of the person they thought they were electing in 1999. I'd like to ask the minister now, you were in Ottawa as our Minister of Health. You haven't opened up any new hospital beds. Your government continues to criticize the federal government for not being enough of a player in our health care. I ask you then, Minister, maybe you'll answer this question, or maybe one of your other colleagues wants to stand up and try to defend you. Or here is the very simple question. The deal that you agreed to on behalf of the province of Nova Scotia, did we get enough money from Ottawa, in your view?
The Minister of Health.
Thank you, Mr. Chair. And Mr. Chair, it was the unanimous view of the First Ministers and myself as representing the Premier that we did not get enough money. That was one of the reasons the meeting went on much, much longer than had been planned. What we were looking for as a group was the amount of money recommended by Commissioner Romano in his report. Everyone, of course, welcomed additional money from Ottawa, but it was very important to us to try to get the percentage of funding at least up to 18%, which of our healthcare costs, which did not happen. That being said, obviously, we welcome any support from the federal government. But no, in direct answer to the question, none of us felt that we got enough money. Thank you, Mr. Chair.
Thank you, Minister. I recognize the member from Richmond.
Mr. Chair, in her answers this afternoon, the minister has continually said healthcare is a #1 priority. Putting healthcare #1 is what she's been doing. She hasn't opened up any hospital beds as she said she would. Therefore, I ask her today, if healthcare is your #1 priority, then why, Minister, on behalf of your government, did you accept a bad deal from Ottawa and not put the interests of Nova Scotians here first when you went and signed a deal which you are today saying was not good enough to meet the #1 priority of Nova Scotians, which is a fully funded healthcare system?
I'd like to direct that that question to the Minister of Health.
Thank you, Mr. Chair. And Mr. Chair, actually nothing was signed. That was something that the Prime Minister wanted, but no one did. There was no signed deal. The money was accepted because we need the money. There is no question we need the money. But from the beginning of the meeting, it was obvious that what was on the table was on the table, and that number was not going to change. The only number that did change was the Prime Minister agreeing that if there was a federal surplus next year, which it seems likely that there will be, that he would commit additional money for the healthcare system, and he would do that before he left office. And that obviously is something that we need, our share of that money. But that was the only change from what was on the table right at the beginning, and it was very disappointing to all the representatives of the provinces. Thank you very much, Mr. Chair.
Thank you, Minister. Recognize the member from Richmond.
Mr. Chair, what's disappointing for Nova Scotians is we have a minister that went to Ottawa to represent the people of this province from one coast to another, who said, I'm going to Ottawa with healthcare as my #1 priority. The same minister who came back and told the press, I was shocked and awed by the Prime Minister, and I was so impressed with the other leaders that I thought I'd sit back and not say a word and just watch the action, not speak up. I didn't think that it was proper for me to speak up. I thought I'd let others do the talking for me. That's what Nova Scotians are disappointed in today, Mr. Chair, that the minister who said, I'll open up new hospital beds, went to Ottawa and wouldn't even talk for the people of this province, wouldn't even put up a fight on behalf of the people here, and wouldn't say that this deal wasn't good enough for the people of Nova Scotia, that Nova Scotians would not accept this. Yet, Mr. Chair, she said that the First Ministers all agreed. We all know that that's not true, because the Northern leaders said this is not good enough, and they said we're going home, and we are not agreeing to this deal. We want better. This is not good enough for the people we represent. And what happened, Mr. Chair? They got a better deal for their constituents. They stood up and fought for them. They didn't sit shocked and awed at the Prime Minister. They did speak up. They walked away from the table, and they got a better deal. And I ask again, Minister, why did you not take the lead of the Northern leaders and walk away and say, I will not accept a bad deal on behalf of the people of Nova Scotia?
I'd like to recognize the Minister of Health.
Thank you, Mr. Chair. And what I did and what the Minister of Finance, who was also there, did was accept a deal that gave more healthcare money to Nova Scotia. That is what the premiers did of the other provinces, and we did accept that. Everyone said at the time, and we were all quoted in the press as saying so, that the money did not close the Romano gap, that we were grateful for the money, but we were disappointed in the amount, and that the accord would mean that the provinces would all be back to discuss the matter of healthcare funding with the Prime Minister's successor. Thank you, Mr. Chair.
Thank you, Minister. I recognize the member from Richmond.
Mr. Chair, the Minister of Health had a choice. She had a choice to walk away. She had a choice to say this is not good enough. She had the choice to say I'm putting Nova Scotians first and saying this is not good enough. She had a choice in saying, I'm going to try to live up to the commitments I made in 1999 of opening new hospital beds and protecting our healthcare system. I will not accept a bad deal. I will do like the Northern leaders did, and I will walk away. Because in fact, this minister had even more authority there, because it is Nova Scotia that chairs the Premier's Council. She could have shown leadership, and she could have said, this is not good enough. We will not agree to a bad deal. We will walk away. Instead, what do we see once again? A minister having to give us political spin rather than admit failure again to live up to the commitments that she made both to her constituents and that she made to the people of this province. She had a choice. She could have walked away. She chose not to. She gave in, and then they have the audacity to come in this house and say, we didn't get enough from Ottawa. You agreed to the deal. You said this is enough. You said, I'm going to forget about Nova Scotians because, for me to get a better deal, I'd actually have to speak up. And I'd actually have to say something to the Prime Minister rather than sit back and be shocked and awed by his performance. And say, what a great...
Order.
Mr. Chair.
Order. Order, please. Order, please. Order, please. Order, please. The member from Richmond has the floor.
Mr. Chair, I invite my colleagues to read the Chronicle Herald. When the minister was interviewed on her way to the airport, who said, I was awed by the Prime Minister of Canada. I was awed by his presence in the room. I was awed by how he dealt with the premiers. These are not my words. Read them in the paper. The member from Dartmouth North can read them in the paper. She was shocked and awed by the Prime Minister. Where were Nova Scotians' priorities, Minister, when you were shocked and awed by the Prime Minister of Canada, when rather than walking away, you accepted a deal which did not meet the needs of Nova Scotians? You did not put health care as our number one priority. And I ask you again, you had the option to walk away and say, I will stand for the people of Nova Scotia and saying this deal is not good enough. I will follow the example if she needed something to follow, which apparently she did while she was up there. I will follow the Northern leader's example and say this is not good enough and we will not agree to something that doesn't meet the needs of our residents. I ask you again, Minister, you still haven't opened up any new hospital beds. You haven't protected our healthcare system. Why did you agree to a deal which was a bad deal for the people of Nova Scotia and did not address our healthcare needs fully?
The Minister of Health.
Thank you, Mr. Chair. And Mr. Chair, I think everyone would agree that as the representative of the Premier and as someone who was constantly in touch with the Premier and who was having discussion with other premiers, that Nova Scotians are better off because of having more money from the federal government. That doesn't change the fact that it did not meet the expectations of the premiers and that it did not meet the recommendations of Commissioner Romanow. And that has been very clear from the beginning. Thank you, Mr. Chair.
Thank you, Minister. Before I recognize the member from Richmond, I'd like to inform him that he has 10 minutes left in turn.
Thank you, Mr. Chair. Mr. Chair, how interesting it is to see now that the Minister of Health hides behind the Premier now and saying, well, she was in touch with the Premier and maybe it was the Premier's fault for all this. Well, we'll have our day to ask the Premier that question. You were the one, Minister, who went up there to Ottawa. You were the person entrusted by the people of Nova Scotia, by the people of Halifax Citadel, by seniors, by all Nova Scotians, young and old, to go up there and get the best health care deal that represented the needs of Nova Scotians. The health care deal that you said Ottawa wasn't providing enough money, that you said I will go to Ottawa and I am going to get the money needed to fix the health care system. Because the Premier didn't just say, I'm going to try to make the health care system in this province a little better. He said in 1999 he would fix it.
Fix it, right.
Now we have a minister who went to Ottawa who said, well, I just wanted to get money to make the system maybe a little bit better, but not fix it. The Northern leaders walked away, and what did they get for walking away? They got more money. They got a chance to fix their healthcare system because they said this is not good enough. Yet what do we have here? We have a minister who goes up to Ottawa, a minister who said, I will open up hospital beds. Hasn't opened one yet, and there's not one coming anywhere in the near future. She still won't admit it here today, that the commitment she made to her own constituents she has failed to do, yet she gives us the same political spin. Mr. Chair, she had an opportunity. She had an opportunity to walk away. She had an opportunity to put the interests of Nova Scotians number one. She had, Mr. Chair, she had the opportunity to say, I will not accept a bad deal from Ottawa. I will not accept a deal.
Order, please. Order, please. Order, please. The member from Richmond has the floor.
Well, Mr. Speaker, as I was saying, this minister had a chance. She had a choice. She could have said, I'm putting the interests of Nova Scotians first.
Didn't do it.
I am not going to sit here and be shocked and awed by the Prime Minister. I'm not going to sit here and say, I'm intimidated. I don't really want to speak up because the other ministers and the other premiers, are intimidating. Mr. Speaker, that's not what we elected in 1999. A government that would say was intimidated by the other provinces. And when it goes up to Ottawa, a government which has consistently criticized Ottawa day in, day out and said not enough money. When they've got their chance, they've got the Romano report that clearly says how much money is needed. And then when given the opportunity to go up there and get the money necessary, not to make our healthcare system better, but minister to fix it, just like the Premier said he would. And today what you are again doing is admitting you've broken your promise. You have failed to fix our healthcare system. You failed to get a deal from Ottawa that would have allowed you to fix our healthcare system. I ask you again, why did you not exercise your option to walk away, to lobby for a better deal, and to say, I'm putting Nova Scotians as my number one priority, not in what the other premiers want to see, not in what the Prime Minister is saying, but I'm going to make sure that I walk back to Nova Scotia and say, I went to Ottawa and I got the money needed to fix this healthcare system, and watch us, we don't need spin doctors. We're going to show you how we're going to fix that system. I'm going to open up hospital beds like I said I would in 1999. I ask again, why, Minister, didn't you walk away from a bad deal for Nova Scotia?
Yeah. The Minister of Health.
Thank you, Mr. Chair. What I would say to that is that walking away from federal money was not going to improve the health care of Nova Scotians. And Mr. Chair, walking away from the table would not have improved the health care of Nova Scotians. Thank you, Mr. Chair.
Thank you. Minister, recognize the member from Richmond.
Mr. Chair, the Northern leaders walked away. And what did it get them? Did they go home empty-handed?
Big, tough guy.
No, they got more money. That's what happened when they walked away. Yet the minister now says, well, if I'd walked away, I was intimidated as it was. I was shocked and awed. I was afraid I wouldn't get anything and I'd have to come home, showing defeat. The Northern leaders walked away. They said this deal is not good enough for our citizens. It won't fix the problems we have in our healthcare system. As a result of walking away, they got a better deal.
Right.
That's what walking away did for them, Minister.
Right.
They are proof of what happens when you put your residents as your number one priority, rather than sit back and say, I was shocked and awed by the Prime Minister and I didn't want to ask any questions. I was afraid that I would be out of line. Mr. Speaker, today we see the Minister, the Minister of Finance in his own budget speech, again says, well, Ottawa didn't give us enough money. Why did they not give us enough money? Because of the failures of his Minister of Health when she went to Ottawa. And that she failed to bring back to Nova Scotians the deal she needed to live up to the commitment she made in 1999. She failed to bring back the commitment which would have allowed her to save face next election and say, I did open up the hospital beds I said I would, because now she has to go campaigning, giving us the political spin she's given us today, saying, well, we've moved this here and we've moved that there. Yet at the end of the day, no new hospital beds like she said she would. And I can assure you, for her residents watching today and in the campaign coming, they will be reminded of the words in this crass, cynical, mean-spirited political campaign undertaken by that member. Because, Mr. Speaker, at the end of the day, the waiting lines are not reduced. There are still people, I know of my own family members, who've had told they have to wait for months for important treatments. Why? There are no beds available. What has happened in the Aberdeen Hospital lately? They're having to put beds in the hallways because there's no place to put them.
Yep.
We've consistently seen emergency room closures in Glace Bay, the Straight Richmond Hospital, North Sydney. We continue to see them even here on the mainland.
Yep.
Yet, the minister went to Ottawa, and you had a choice. You could have come home and said, I will not accept a bad deal. I will continue to fight Ottawa until we get the money we need to fix the system like we said we would. You could have said no. And Minister, you walked away. And what's the legacy of your meetings? Your comments about how impressed you were about the Prime Minister and the fact that you chose not to ask any questions, not to stand up for Nova Scotians. Shame on you, Minister. Shame on you for the lost opportunity that we were given. When is the next time that we will have the opportunity as Canadian provinces to go to Ottawa and to fight for such an infusion of cash? When will that come up again, Mr. Chair? Now we hear the minister try to put a little bit of cheap politics in there and saying, well, we'll go see the Prime Minister's successor. That is our argument now. I failed with Chrétien. I'm going to wait till Chrétien's gone and go try a little bit better. I guess we'll have to wait and see what success the minister then has. But if she goes up to Ottawa again on our behalf, Minister, we'd ask that you speak up. We'd ask that you not sit back and be shocked and awed by the Prime Minister. We'd ask that you put the interests of Nova Scotians first, and we'd ask that you make sure that you come back from Ottawa with a deal that addresses the healthcare needs of all Nova Scotians once and for all, rather than accepting a bad deal. Mr. Chair, how much time have I got left?
2 minutes.
Mr. Chair, in closing, I want to say that what we have seen today, Mr. Chair, is a minister that was continually given the opportunity today to say, I wasn't able to live up to the commitment I made in 1999. I undertook a cynical, cheap, mean-spirited campaign to get your vote, yet at the end of the day, I have not lived up to my commitment. That is the opportunity the minister had, to be able to say, I will be honest and forthright with my electors. I will make sure that they know that I may have tried, but I failed in living up to that commitment. At the end of the day, Mr. Chair, she had the opportunity. She had the opportunity to tell us today why she accepted a bad deal from Ottawa, which now her government says at every opportunity that they did not get the money that they needed to fix the healthcare system. That is the legacy that this minister will leave as history looks back, that at the one opportunity she could have said no to Ottawa. She could have said, I will put the interest of Nova Scotians first. I will make sure that we get the money from Ottawa needed to fix this healthcare system. She wasted that opportunity by sitting back and saying, I was in awe of the Prime Minister and I was intimidated by the other premiers and didn't feel it was my role to speak up for Nova Scotians. That, Mr. Chair, is shameful. And now to see this government stand up and say, we did not get enough money from Ottawa, this minister must accept responsibility for that. Her constituents will be reminded of that in the next campaign. Nova Scotians are reminded of that today. At the end of the day, Mr. Speaker, we had an opportunity, and that lost opportunity rests on the shoulders of this Minister of Health. And I ask her again, why did you not walk away from a bad deal?
Order, please. Time has expired for the Liberal caucus. And I would like to recognize the member from Halifax, Needham, with 1 hour in turn, time being 3:17, 4:17. The NDP caucus time will expire.
Well, thank you very much, Mr. Chair. It's really interesting, you know, listening to members of the third party sometimes. Here, hard, difficult but interesting. Difficult but interesting, I would say. I mean, isn't it interesting? You know, the leader of the third party, I think, if my memory serves me right, has spent a lot of time talking about his commitment to building a better working relationship between this province and Ottawa. Doesn't he say that that's what he's going to bring to the arena? Yet the member from Richmond thinks our health minister should have walked out of the negotiations with, well, you know, Mr. Chair, You know, Mr. Chair, sometimes some of us in this chamber need to be able to rise above crass partisan politics and do what's in the interest of the province, you know? And I think also one of the things that's...
Order, please. Order, please. Order, please. Order, please. Order, please. We'll just wait until the chamber's quiet. Order, please. The member from Halifax, Needham, has the floor.
Thank you very much, Mr. Speaker. Another thing that I found quite interesting is, you know, we spend 3/4 of an hour talking about the loss of hospital beds, which, granted, you know, is something we need to be concerned about, but it is a little contradictory, again, when the minister, or when the leader of the third party has been placing his emphasis on a different kind of health care, on health promotion and wellness. And so I'm really wondering, what is it with the Liberal Party? Like, where are they? Are they cooperators with Ottawa, or are they confronters? Are they for hospital beds, or are they for health promotion and wellness? Like, where are this party? Well, we know where they are. They're in third place. They're over there, and that's where they're going to stay.
They're in disarray.
Yes, that's right. In complete disarray. Does the leader of the third party have any idea what the members of his caucus are doing here when they're on the floor in this House? I think not, Mr. Speaker. I think not. Having said that, I would like to use my hour to talk about things in the budget that are of concern to Nova Scotians and not necessarily narrowly of concern to a dwindling Liberal caucus, Mr. Speaker, a dwindling number of Nova Scotians. Mr. Speaker, I want to start and talk with the minister a bit about home care, which does have a connection to the reduction in hospital beds. And I did have an opportunity to raise a few concerns about this the last time I had a chance to question the minister, but not in the detail that I'd like. So what I'd like to say to the minister is that in the last 10 years, there's been a 40% reduction, or a close to 40% reduction in the number of beds per thousand population in Nova Scotia. 10 years ago, according to Department of Health figures, there were 5.3 beds per 1,000 population, and today it's 3.2 beds. Now, I would like to know exactly how many beds this represents in terms of a reduction that we have lost out of our system. And then I would like to talk about the plan to provide more home care to people in their homes who are being discharged out of hospital more quickly as a result of the reduction in hospital beds and the plans for the utilization of the beds we do have. So I'll start there. Do we know exactly, numerically, how many beds this represents that we've lost?
Thank you for the question. I recognize the Minister of Health. The Minister of Health.
Thank you, Mr. Chair. And that number would be about 2,500. But obviously, home care services have grown hugely in that time. Thank you, Mr. Chair.
Thank you, Minister. Recognize the member from Halifax, Needham.
When I look at the estimates in terms of the home care services, which are broken down by district, I notice that there are three districts that will see reductions in their home care budgets. for next year. The Capital District is one, District 1 and District 2 are the other two districts. And of the districts that are having increases in their home care budgets, two of them are seeing fairly substantial increases. I think the Cape Breton would be having the $3 million increase, and there's a $2 million increase in District 4. But the amounts of increases in the other districts where there are increases are relatively small. Now, I want to tell the minister about a call I got into my office today. An elderly man, 85 years old, his wife has recently had hip replacement, and they are she was his caregiver before she herself became sick, and now they receive home care, but a minimal amount of home care. It's something like an hour a day. And our office contacted the home care coordinator, who said that they need more home care than they're getting, but there isn't staff. Now, we talked about this a bit last week, that there are these shortages of home care providers, but we still are in this situation where people's needs aren't being met. So I guess the question I have is, what is the department's plan to address this very serious situation where the home care resources are stretched very, very thin, where people who have need, who have assessed need, are not seeing the services that they need provided? And why is it that in the budget, home care, the dollars for home care services in some of the districts is going down and not up?
Thank you. I'll direct that to the Minister of Health.
Thank you, Mr. Chair. And one of the reasons the numbers for districts have been adjusted is because last year was the first year we had, quite good standardized information from all the providers about what their services were and what the needs were. So the numbers here have tried to reflect where the greatest need is according to this standardized information. And so while we believe it is a more accurate reflection of where the dollars are needed, I don't think there's any pretense that there aren't needs out there that aren't being met as well as they should. And I do know that there are staffing vacancies that are preventing the allocation of services in some cases. Some of the money that we're putting into home care this year is going to be used to reduce wait lists for home care. But I wouldn't pretend that there isn't a great deal of work that needs to be done on that system. And although we are seeing some improvements, there are still very real issues out there that need to be met, and funding that is going to have to be increased even more over time. Thank you, Mr. Chair.
Thank you, Minister. I'd like to recognize the member from Halifax, Needham.
Thank you, Mr. Chair. When we began to analyze and criticize the financial assessment tools, the forms, and the information that was being assessed around long-term care, one of the things that I said when I looked at some of this material that our research people were gathering was that I felt that what I call the social content in the financial assessment tools, the social content had disappeared, and it had become a very, you know, a very much just a dollars kind of document that did not take account of the reality of how people live their lives, the community dwelling spouse, for example. Now, I say that probably because I come from a social work background, and I look at the kinds of things people need to stay well. When I look at home care and the assessment tools and the assessment process that is occurring now, I have to be very candid with the minister that I have some similar concerns, and that I've heard the explanation given that we will provide what people need, not what they want. And what people need has been determined in an impersonal and sometimes more removed kind of way from the reality of where people lead their lives. So, for example, the idea is that people don't necessarily need a homemaker to help them change light bulbs in their home or wash a window that they look out, go outside and sit in their yard for a half hour. However, some people who have been housebound for 3 months may in fact really need to get outside for a half hour. And that may in fact contribute greatly to the quality of their life and their wellness, their ability to recover and stay well. So I want to ask the minister whether or not you feel confident that the assessment tools that are being used for home care, for the provision of home care, do take into account people's needs in a realistic way, and that they haven't, like the financial assessment tools that were being used in long-term care, that they haven't been narrowed to try to minimize the amount of care that is provided in a way that's fiscally driven rather than in terms of the health care needs of people who require service.
Thank you for your comment. I'd like to recognize the Minister of Health.
Thank you, Mr. Chair. And I do recognize the issue of unmet needs, particularly in individual situations where I'm sure, well, I know in fact that the member for Halifax Needham is right, that sometimes little things that aren't covered, you know, are what the doctor ordered, so to speak. But I believe that we have improved the care assessment for people needing home care and long-term care. The care assessment tools that we use are used all over the world, and we use the same assessment for home care and long-term care to try to get at the right kind of care. I mean, in terms of what an individual needs. But I can't disagree with the member for Halifax Needham in that we need improved services in many instances in home care. But again, even though we have a lot more money in this year's budget, we also have unmet needs in the area, for example, of palliative care. Some areas of the province do better than others, and there's a strong need out there. That's just one example of needs that also have to be met. So I would say that while we have made improvements, we certainly have a long way to go in many areas of health care, including home care. Thank you, Mr. Chair.
Thank you, Minister. I'd like to recognize the member from Halifax Needham.
Thank you very much. Well, certainly another aspect of this is the pressures that the shift in our healthcare system away from the utilization and reliance on acute care beds to a more home care model has put on family members. And I guess people express to me quite often the difficulty they have providing or meeting the expectations that are built into that assessment process to provide adequate care to people who are left recovering at home. I'm wondering what kind of ongoing assessment does the department do of the impact of caregiving in these situations on the caregivers themselves? And I know that there is a slight increase in the caregivers' tax credit, but it's very small in proportion to what many people actually absorb, both financially, but I'm thinking more around the wellness of people who are caregivers. Many of these people are increasingly an aging group themselves. As people live longer, you'll have people in their 80s and 90s who are being cared for by their children who may be in their 50s and 60s and 70s. And certainly I meet many people in my constituency who are exhausted trying to provide care, and the impact this has on their own health is quite profound. But in trying to get the assessors to take that into consideration when they're looking at what's required in a household is really difficult. It's very difficult to get that looked at. Or, for example, even if the people are younger, if they're in their 20s, they may be working at jobs where they're in the labor force 40 hours or more a week, and they don't have a lot of time left for caregiving in the home. So I'm wondering what the department is doing to try to look at ways to alleviate the stress and the exhaustion that many caregivers themselves face when a member of their family gets sick and is discharged home.
The Honourable Minister of Health.
Chair. Actually, that subject is an important one. It's something that is being discussed at the federal, provincial level because it's recognized that it's a growing area of concern. It's also it's an aspect of a study in geriatrics that's going on out at Mount St. Vincent University. I believe it's Janice Keefe who's heading up this project, and she's been working quite closely with the department. I think we've supplied her with I know we've supplied her with a fair bit of information that we have, and that is one of the aspects of her research, is looking at the effect of this on the caregiver. I know it is an issue with an aging population. This wasn't home care, but I know when my own mother was dying, I guess it was us, the family, participating in palliative care, that it was impossible for my sister and I to turn my mom over because the tumor was so big. And these kinds of things are, you don't think of them beforehand, but they do occur to people all the time, and they do put incredible physical, and emotional stress on people. And so no, we don't do ongoing monitoring because it's a relatively new area of concern, but certainly we're aware of it and are participating in research on it. Thank you, Mr. Chair.
The member for Halifax Needham.
Thank you, Mr. Chair, and thank you, Minister. I want then to ask you some question about the in-home supports program. My reading of this is that there will be no increase in that program this year, and I'm wondering what the minister can tell me about the waiting lists for in-home supports. how many people are waiting for these services, and why wasn't there greater attempt made to provide additional services for in-home supports?
The Honourable Minister of Health.
Thank you, Mr. Chair. And Mr. Chair, the department absolutely recognizes that it needs to move on this program. It's just that we needed to move on other things as well, including long-term care. So that while we have pretty well finished our work on standards for a better in-home support program, we were unable to fund it this year. We have about 600 currently, I think the member probably knows that number, receiving in-home support, and we do provide them with monies. There is I believe I had a question about this the other day in question period, or perhaps it was in estimates, that we do have a new program with the Red Cross, an equipment loan program, and well, it's considerably expanded, and we do think that this program will help people who need in-home supports in terms of the physical devices they may need, whether it be, a wheelchair or a lift or something like that. So we will be able to effect improvements in that way. But no, we are ready to proceed with a new program, but there is no funding for it in this fiscal year. Thank you, Mr. Chair.
The member for Halifax Needham.
Thank you very much. With that, I'm wondering is the self-managed care pilot projects a part of that, and have those projects been evaluated, and is there any plan to expand those projects, or where does that stand? Because as I understand it, these projects have been on the go for about 6 years. The people themselves who are able to schedule and organize their own in-home supports find them extraordinarily useful, and they're very satisfied, and they would like to see government provide these services to more people. So I would like to know from the minister where that particular program stands.
The Honourable Minister of Health.
Thank you, Mr. Chair. And the staff informed me that the department isn't actually funding pilot projects. I'm not sure, since the program came over from Community Services, if there might be an answer there, but we are continuing the funding to the clients of the program, but we are not actually participating, that we know of, in pilot projects. We have certainly evaluated, the program, and we know we have a good idea of how to improve it, but the actual pilot projects themselves, I don't have the answer to that.
I recognize the member for Halifax Needham.
Thank you very much. Maybe that's something we could get some clarification on at a later time. I want to ask the minister about the government's plans with respect to assisted living. We're seeing a lot of new facilities opening that characterize themselves as assisted living. So they're not long-term care facilities, they're not nursing home facilities, but they are places where seniors in particular who are no longer no longer want to, or maybe even are able to remain in their own homes, don't want to be, doing maintenance, don't want to be cooking meals even, but want to be in an environment where they have some independence, where they have some privacy, where they can come and go as they please, but they also have people around them to provide services and to take care of some of their basic needs. So we're seeing these places open, but they're all private pay, and they tend to be not just private pay, but very expensive forms of residential living. And it seems to me that the interest in the community in assisted living residences reflects a need. But meeting that need entirely at this time is based on ability to privately purchase a home or a residence in an assisted living facility. So I'm wondering what the Department of Health is doing with respect to examining assisted living as an option for seniors, as a new sort of development in both housing and care.
The Honourable Minister of Health.
Thank you, Mr. Chair. Well, at the moment, the assisted living facilities are strictly private. They're not something that the department licenses or finances. But it is an increasingly attractive option for many people. Now, we may provide home care for people in assisted living conditions based on income, but the member is right, since we don't license and we don't pay per diems and we don't, financially support this aspect of a facility, that we're not really involved. However, as what we are looking at and will be looking at more closely in the future is whether or not these facilities should be, or not, I'm not prejudging the matter, included in new facilities that get approved, that get built in Nova Scotia, because it may be a good option in many cases that new facilities include assisted living quarters. And certainly we know, in terms of nursing homes, that we have to really look carefully at where they're built. And we have looked at models from the UK and Denmark. But one of the issues with nursing homes is not just, well, you were bringing up the boarding homes and the so-called small option homes earlier in estimates as part of the solution, perhaps more so in rural communities than in urban ones, but as part of the mix. And we definitely have to look at whether or not facilities include assisted living areas when we're looking at what may be built in the future and where the nursing homes may be built, because it could make things a lot easier for the clients, and we need to, and the families, if we do that. So, thank you, Mr. Chair.
The member for Halifax Needham.
Thank you very much. I have a particularly interest in this, I guess, for a variety of reasons, including that I have a lot of senior citizens matters in my constituency. And it's interesting, 20 years ago when I first did social work in the North End, people who lived at Sunrise Manor, for example, may have been in their late 50s, early 60s, and today, 20-some years later, they're still there. But you know, as they age, they have a different set of needs, and they still want to, when they can, maintain independence and stay there. But sometimes they need a little more support. And I'm wondering about the whether or not public health nurses, there's been some focus on public health nurses being available to make home visits for new mothers, and this program that has the Premier certainly talks about. But what about public health nurses doing home visits for seniors? Is there anything to prohibit this from happening now? What would the process be if, what would the process be, for example, for a family or a neighbor or someone who felt that a senior in their community but didn't need adult protection, didn't need, you know, any form of institutional care, but maybe needed something beyond just being there by themselves, and having a public health nurse come through and take a look at, you know, the amount of medication that somebody is on, and whether or not there are prescriptions that, you know, sort of interact with one another in a negative way, or giving people advice around the kinds of foods that they should or shouldn't eat with particular kinds of prescriptions, and all of this kind of stuff. It seems to me that there is a role for public health in the area of working with seniors and keeping seniors in their own homes and keeping them healthy in their own homes and in their own communities. So the question I have then is, do public health nurses play that role? If not, why not? Has the department looked at this from a public health perspective, what's happening with respect to seniors?
The Honourable Minister of Health.
Yeah. Thank you, Mr. Chair. I think the public health nurses play some role now, but it's not a comprehensive system by any means. We're going to be, the department is going to be developing a vision for continuing care within the next fiscal year. There are going to be a lot of consultations with the various stakeholders, and this is going to include obviously discussions about, you know, nursing homes, assisted living, new facilities, the services that are offered, the standards there, new models of services. And actually that's you know, a very good idea to include the role of public health nurses in that discussion, because, and it may also be, whether it's considered health promotion or whether it's health, doesn't really matter. It's not, it's one of those things that crosses the divide. It's a very good idea to examine that. So I credit the member opposite with some of her good ideas that have come up in the past few days. Thank you, Mr. Chair.
The member for Halifax Needham.
Thank you very much. Okay, I'd like to take a wee bit of time to talk about mental health services as well. Mental health services are extraordinarily important, and unfortunately, mental health services, I think, historically get the short shift in many respects in the in healthcare expenditures. We've seen certainly the loss of mental health beds in institutional settings, and for many people, this represents progress to a more community-based form of service delivery for people with mental illness. But at the same time, there are people who feel that we've cut too deeply, and that when beds are most needed for someone who has you know, a serious need for hospitalization, that the services aren't there. I'm wondering if the minister can tell me how many mental health beds there are in the province right now, and whether or not you can give me a breakdown of where they are too in the various regions.
The Honourable Minister of Health.
Thank you, Mr. Chair. And we don't have that here in the estimates broken down like that, but that is information that is fairly easily obtained, and we can get that answer for the member. And I wonder, while I'm at it, there were some questions asked in the last estimates that I have answers for, if I could table those. And yes, again, we commit to getting those figures for the member from Halifax-Needham.
I recognize the member from Halifax-Needham.
Thank you very much. And last, I think 2 Sundays ago, there was a forum on the future of Medicare, and Dr. Bob Fredericks was at the forum, and I think I mentioned here that he spoke about the difficulty getting various services, but in particular, he made a statement about mental health services and the needs of children. And I know that there have been some initiatives that have been announced, which I think we all welcome and embrace, knowing how difficult it is to get services for kids that really, children and adolescents that really require mental health services. But there are parts of the province that will be without these services. And I'm wondering what the plan is to address those areas where there won't be these programs operating, where certainly there will be children and adolescents that will require mental health services.
The Honourable Minister of Health.
Thank you, Mr. Chair. And we actually think that with some of the new money that's been announced for mental health services for children and teens, that we will be able to meet a huge portion of the need that is out there now. And what we plan to do, because this was a question that came from the media and came up when we made the announcements, that although the teams that we're assembling in Metro and in Cape Breton, which would cover about 70% of the young people needing these services, what about the other 30%? What about kids from Yarmouth or Kentville? And what we plan to do after we've set up these teams in the bigger areas is evaluate what is most successful about the teams, and to try to see how we can set up teams in other areas that aren't served, that perhaps may not, necessarily be as big, but could help provide or could provide the same kinds of service. Because you might not need as big a team of professionals or of full-time professionals in a smaller area as you would in an urban area like Metro or Sydney. And these people are now being hired. And I agree it seems a bit of a wait, but the plan isn't to just only serve Sydney and Metro and let the chips fall where they may elsewhere. It's also true that in some of the cases that we'll need a bed, that the new facility being built here isn't going to be just for people from the metro area. If there is an urgent case that really needs a bed coming from Wedgeport or Digby, that facility would be available. I realize it's not built now, but it is going to be built, and it will be available to children from all around the province. So we have a fair bit of confidence that the money we've allocated for this project will meet an awful lot of the needs that are now being unmet. Thank you, Mr. Chair.
The member for Halifax Needham.
Thank you, Mr. Chair, and thank the Minister. Now, I've had several cases with kids in my constituency, families in my constituency, that have been in huge crisis around issues that their children had. And one of the things in advocating for these families through the system that I encountered was a real reluctance to admit children into hospital. And on the one hand, I understood what was going on entirely, because the reluctance was that if we got this child in here, how long will we have this child? The fear was that the child would be stuck in the hospital without a plan or a place to discharge the child to, when it was clear that the family, for a variety of reasons, was not going to be a place where a child could be discharged back to. So I understand that concern from the institution's point of view, having been the adolescent social worker one time myself in those situations. But at the same time, everybody agreed that the child absolutely needed service and needed it right now. It was a crisis, and something needed